At the end,
Oh,
I
at
want
the
to
end,
talk
okay.
about another
Right.
subject, but thanks.
Okay, okay. Well, they called me yesterday, a little bit about my background, so that you know where I'm coming from. As I give this, I have been an assistant with surgery groups, assisting in the operating room for the last 30 years. And about 2 years ago is when I got immersed in being a patient. I had a rare neuromuscular disease that paralyzed my diaphragm so I couldn't breathe. And then it paralyzed my right arm at the same time. So I was on a ventilator for a couple of months, and so you get a real good feel for being a patient after going through something like that. The diaphragm's still paralyzed, so that's why I'm here today. I can't work in the operating room anymore. So I have a lot of knowledge of seeing patients in the office and a lot of knowledge of being a patient. So I'll try and give it from both perspectives, but basically what we're trying to get across today is how to be a better advocate for yourself and how to help yourself manage your own health care and your family's health care. Because as we know, all health care costs are going up, and there doesn't seem to be any significant stop to that. So the focus today is, like I said, is self-care. And a big part of medical conditions and disease processes is a lot of things can be treated without going to a doctor or a hospital or an urgent care or an emergency room. A lot of things, minor things, can just be treated just by calling a nurse or talking to a friend, or if you have a family that's a nurse or something like that. A lot of times you can get answers that way without actually needing to seek professional care. Like it says, over a third of all medical conditions can be treated, what we were just saying, without going someplace. And this is obviously an old slide because it says that as of 2014, they say that healthcare costs were expected to double, but more than double. So I don't know how old this slide is, but it went up even more than doubling. So this is just a big picture of how things are changing. I'm not sure if it'll work. The new technologies. Now this is something that I've been involved with because I worked with a heart surgery team for years and years and years. We did heart bypasses, put in new valves, took out the aortas and put new aortas in. And so the new technologies are absolutely amazing. We do heart surgery now with a robot in a percentage of the cases. Not everybody can have it done utilizing a robot, but just one of those Da Vinci robots is $2 million. Then each time you open a packet of instruments, that's another $10,000. So all of these technologies utilize a lot of money. And so the amount of money that we have available for all this stuff is not indefinite. I mean, there is an end to it. So we have to, and the patients have to, try to learn to utilize the healthcare as best as they can. Because in the long run, we're all in this together. I mean, this is our country and our medical care. So if we don't all take an active role in this, then healthcare costs are going to just continue to balloon. The medical inflation rate, I don't know if everybody realizes this, but it's 10% per year is how much the inflation is on medical costs. Now, your cost of living or your inflation rate, my inflation rate, is usually 2 to 3% per year, but in the medical field, the inflation rate goes at 10% per year. Now, that's what people bill, but that's not what people get paid. So, also prescription drugs have gone up so significantly. So whenever it's possible, always ask for a generic. There are 47 million uninsured still in this country, even though we now have Obamacare, which a lot of people, that's almost has a negative connotation to it. But as a medical staff person, we don't really know if Obamacare is bad or not yet. But everybody seems to, it seems to carry this negative connotation that everybody thinks is bad, but we don't know yet. It's so young. It may work just fine. And like any other program, especially one this large, it takes time and tweaking to get it good. I mean, this is such a massive, massive undertaking. No one political party can solve this problem on their own. So it's going to take years to get this program better, but at least somebody started. I'm not a Democrat, so, but I'm just saying I was glad that somebody started something. Life expectancy, this is something new. For the last 15 years, life expectancy has gone down instead of up. It's been going up for the last half century, where in the 50s, the 1950s, it was, life expectancy was about 63, 64, and then it constantly went up. And now it's 78 for men and almost 80 for women. But in the last 15 years, it's been dwindling down again. And that's a lot of it because patients aren't taking care of themselves. Our whole society has gotten lazy. So, and that comes along with technology. The more technology we utilize, the lazier we get. And the lazier we get, the less healthy we are. So that's just, I'm just throwing that out there for shits and giggles. Another thing that people don't think about is this right here. The workforce has been aging. People don't retire all at 65 anymore. We have patients that from Ford that we do heart bypasses on, they're 73, 74 years old and they're still working full time out at Ford. So our workforce is aging, and that in and of itself is not so much of a problem, except it puts a bigger burden on private insurance, because if you're still working, then Medicare isn't your primary insurance. Your primary insurance is whatever insurance you have through your employer. So it puts a bigger burden because the older the workforce, the more serious the illnesses. About 70% of all health care costs that you will incur in your lifetime, you will incur in the last 5 years of your life. So if you live to be 80, the first 75 years of your life, you only use about 20% of your health care costs. 80% are incurred in the last 5 years. So if we do a better job of taking care of ourselves now, we'll have less costs when we're older, and that will save our children from having the same kind of problems that we're going through now. Now, if I start rambling, I apologize, because I do have a tendency to do that. Can everybody still hear me? Okay, great. Chronic diseases makes up a very large portion. Now, I'm not going to read these slides to you because you can read for yourself, but makes up a very large portion of all of our health problems in the United States. Now, it says here, oh, sorry, wrong button. It says down here at the bottom, this is something I kind of don't agree with, but this PowerPoint was given to me. Improving your own health care or your own health can help decrease the risk of getting these chronic illnesses. That's not actually true. If you read that literally, a chronic disease is a chronic disease. You cannot prevent a chronic disease, but you can better control a chronic disease, like diabetes. Now, if you are somebody that has a genetic predisposition to diabetes, you're not going to prevent that no matter how good you take care of yourself. But you can control the complications, because diabetes in and of itself is not a death sentence anymore, because we can control blood sugars very well. If the patients work on their own to help keep themselves healthy by staying active and reducing their carb and fat intake, then the major problems that come along with diabetes are peripheral vascular disease. So patients end up with amputated toes and feet and legs. The ophthalmic problems, people go blind from diabetes. The kidney problems, that's huge in diabetes, because the kidney basically is a filter for the body. And it's made up of millions of small blood vessels. Well, if you have diabetes and you don't take care of yourself, it clogs up those small blood vessels in the kidneys don't work, and then you end up on dialysis. And those patients utilize an enormous amount of our healthcare costs. So my point being is that, you know, this is kind of putting the onus too much on the patient. You can't prevent these illnesses, but you can reduce the severity of it. So how you can initiate and take control of healthcare spending, we've been talking about that. First thing I want to talk about is maximizing every minute in the doctor's office, because that's what I have the most experience in, and because I've seen over the last 30 years about 150 patients a week in the office for the doctors. And what happens a lot of times is the patient, it might have been 2 or 3 weeks, or it might have been a month from the time that the appointment was made until you have that appointment. So in that interim, and right when you go to your family practitioner, make sure you write down all the problems that you think you're having. Don't just trust your memory that you're going to be able to recall these things. And write down everything, not just the most important, but some of the trivial things, because sometimes when we make a diagnosis, it's like putting a puzzle together. And the one thing you say to us is just one piece of a puzzle. It may be a big piece, but we need all those other little pieces. So if you're having multiple issues, multiple problems, write them all down. I don't care if it's fungus on your little toenail. Make sure you mention all of these problems. Because let's say you're a patient with diabetes and kidney disease and peripheral vascular disease. Well, that problem in your toe can lead to a bigger problem, can lead to a toe amputation, can lead to a foot amputation, can lead to a leg amputation. So even though you may think something's little, the doctor needs to hear about all of it, and you're not going to remember all of it. And trust me, as the older I get, the less I remember. So even myself, when I go to see my pulmonologist and my neurologist, I write all this stuff down, because I'll forget it. I really will. I mean, and I've been doing this a long time. So write stuff down. And also, and this is, I'm glad they included this, because we get this all the time. A wife will come in for an appointment, and then while she's there, she'll say, you know, my husband's having this problem and this problem and this problem. And as silly as it may sound, generally, the health practitioner that you're going to see, if it's a nurse practitioner or a PA or a doctor, they'll tell you what they think. You know, so basically you can, a lot of times, get a free doctor's visit, you know, just by mentioning what another family member's having, or a spouse or brother or sister. So don't be afraid to mention stuff like that. If you're going into a doctor's office, it's very easy for me to say, don't be intimidated, but it's very hard to do. But what I always tell our patients is, I'm working for you. I'm not the boss. When you come in to see me, I'm not the boss. You're the boss. I'm working for you. So don't be afraid to talk to them about anything you feel you want to talk to them about, because they'll listen. And people are so afraid of holding the doctor up or blah, 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 blah. And if he makes you wait, which happens a lot, don't be afraid to say, you know, I've been waiting an hour and I want to make sure you're not rushing through my appointment. Because we will have a tendency to do that, especially if a patient isn't having many problems. They come in and it's like, hey, I'm an hour behind, so I'm gonna get through this one in 2 minutes. But that's your time. It's your time that you're paying for. I mean, you wouldn't go to a gas station and be happy if they gave you a half a gallon of gas for the price of a gallon. So don't go into a doctor's appointment and be rushed out of there because he's running behind. That's not your fault and it's not your problem. So take advantage of the full doctor's appointment. But you can be more efficient by writing everything down. And I don't mean just your symptoms, but when the symptoms started, how long do they last? What medications you're on, what allergies you had, what surgeries you've had, and what year did you have those surgeries? Because we need all that. When I do a history and physical, each one of those things is a category, and I need to put something in each one of those areas. So we need to know all the crap that you've been through. Well, I guess I covered most of that. Yeah. Any questions about any of that? Okay. About going to the hospital, we touched on this a little bit. A lot of patients will run to the emergency room as soon as they have an issue. The first thing you need to do is stop and say, is this really an emergency? Do I really need to go to the ER for this visit? Best thing you can do is call a nurse. Every hospital has them. Every insurance company has them. I have a woman that calls me from my insurance company because I have a long-term debilitating problem. She calls me once a month to talk to me about my issues and what's going on and all that stuff. So utilize the call a nurse with your insurance company or with the hospitals. Second thing is call your family doctor. Even if it's 9 o'clock at night, they have an on-call person. And if you don't think, because generally what happens is their recording will say, if this is not an emergency, call back tomorrow during office hours. If this is an emergency, then do this. So if you think it might be an emergency, call your family doctor and go to that part of their prompt on their phone call. And they'll get back with you and they'll let you know. I've got 2 nephews that are physicians and they get calls all the time when we're out drinking and stuff. So, they don't mind telling you what they think it is. And they'll tell you if they feel you need to go to the ER. So utilize those things. If we can reduce emergency room visits, then we can reduce admissions, we can reduce overall healthcare costs. We'll get into that in a little bit, but one thing that a lot of people don't know is that hospitals generate revenue, and I don't want to say make money because all hospitals have to try to break even, but all hospitals generate revenue by admissions. So if you go to the ER, and different hospitals have different admission rates per ER visit. So let's say a hospital, St. Rita, sees 50,000 patients in the ER that year. They'll have a rate that they want to admit, like 30%. So out of those 50,000 patients, they want to admit, what would that be? Well, let's just say 20,000 of those 50,000 people. So you could go to the ER with may not be an emergency and end up with a 3-day hospital admission when you didn't even need to go to the ER in the first place. So try to utilize these other avenues before you go to the ER. This is something I do, and I started doing that with my dad because my dad had a lot of problems. But use the free screenings that are available in the community. So churches, the Y, all these places, the Lions Club, they all have these free, you can utilize like free cholesterols, free blood pressure checks, all these kind of things you can get for free and utilize them because a lot of times you don't know if you have a problem, but if you go see and you go to these free screenings, you may find a problem that you didn't know you had, and that can prevent something from 20 years down the road. Like high cholesterol, if you all of a sudden know you have high cholesterol, you control your cholesterol, and I'm gonna alleviate one old wives' tale right now. A lot of people and even a lot of physicians say that changing your diet to a low-fat diet will help you control your cholesterol. That's absolutely not true. Only 10% of the cholesterol in your body comes from what you eat. 90% of it is made by your liver. So if you're somebody that has a genetic predisposition for high cholesterol, and you have a really high cholesterol, no matter how good you eat, your cholesterol is still going to be high. So you need to take medication. If you do that in your 30s instead of your 60s, that can prevent a lot of heart attacks and a lot of strokes, and a lot of hypertension and a lot of kidney disease. So just little things like doing a cholesterol screening can help prevent a problem 20, 30 years down the road. So utilize these free screenings. Also, keep a good record of your immunizations. Even like I carry a card when the last tetanus shot I had. Just because, you know, people need to know these things. It may sound silly, but an extra shot here and there, that's an extra $150. And if 1 million people do that, that's an extra $150 million we just utilized that we didn't have to. So they sound like small things for you, but when we're taking care of 300 to 400 million people, they really add up. I mean, $1 here and $1 there is $1 billion here and $1 billion there. So keep track of all those things. We already talked about going for generics. Ask for samples. Now, this we used to do a lot, but I can tell you from our practice, they have put constraints on the pharmaceutical companies a lot more than they did 10 or 20 years ago. I can't tell you how many golf vacations and dinners and ball games and stuff that I got free from pharmaceutical companies. But now they can't do all that stuff. They also reduce a lot of the samples that they give out in the offices. But always ask. And don't be afraid to ask, because if they're sitting in their office, they have to give them out to somebody. So there's no harm in asking, even if it's an antibiotic. You know, if you can save the $10 or $20 copay, you know, hell, that's a pizza. You know, I mean, I'm not sure I agree with this buying a pill splitter thing. In theory, it would work, but the doses then can get messed up. So I'm not a big fan of that part of this slide. So obviously use mail order when you can, because that really reduces the cost. We already talked about the 24-hour, 7-day-a-week nurse hotline. And really, if you have a question, and most people in our country have computers and smartphones and all that stuff, and Google is a wonderful thing, but be a little leery of Wikipedia, because Wikipedia is written by people. It's not written by some guru on the subject. I mean, I could be writing Wikipedia articles about women's fashion. I mean, what the hell do I know about women's fashion? So utilize that, and if you look something up and you don't understand it completely, do the call a nurse thing. You know, ask them, because generally they will have things at their hand. They may not be the smartest person in the world, but they have access to billions of things of information. So whenever possible, complete an annual interest survey. And I don't know, I mean, to see what you're educated about, but I mean, when they give out surveys here, don't be afraid to complete that survey and see where you stand with things. Also, attend any wellness things you can. Again, your employer may or may not give you credit for these things, but in the long run, these things will help you. Any information is worth gaining. Read through the newsletters and flyers that you get, because the tendency is, oh, that's junk mail, and just pitch it. But if you just skim through it, there may be one or two things in there that will interest you, and you can learn about one or two more things, and that can help you save some money down the road and be a more informed patient. Because that's what this is all about. The better informed our society is, the better advocate you're going to be for yourself and your family, and that in turn will give better medical care and better outcomes. And the better outcomes save us all money. A couple of stupid stories about this. One was my own father. He had a stroke, and we didn't take him to the ER or anything, because it ended, and it was a mini stroke. We gave him an aspirin. I took him to his doctor, or my sister took him to his doctor the next day, and the doctor set up some tests and gave him a referral. He didn't give him a referral to me, to our group. It was like, Dad, what the hell? I mean, why are you going to go see somebody else? You should come and see our group. He goes, well, that's just who the doctor told me to go see. Don't just be so passive, because our society, our patients are so passive. You take control. If the doctor's office says, well, you need to have this test and you need to have it on this day at this hospital, if that doesn't work for you, tell them, hey, that doesn't work for me. I would rather go to this hospital or this clinic, and I would rather do it on this day. Take control of your own medical care. Because to be honest, when we're scheduling this stuff, we really don't care. But patients just passively go along with what the doctor said. Here's another example. A friend of mine, her mom got a phone call from her sister, because she said, you know, I'm sick. I was supposed to go into the dentist's office today, and I'm not going to be able to make that appointment. And I knew you had told me you needed an appointment. Why don't you go in my place? So she said, all right, I need to go to the dentist. So she went into the dentist. The dentist never asked her, didn't know that this was the sister instead of the patient he was supposed to be seeing, pulled 4 of her teeth. And she let him. I mean, that is the ultimate in passive patient. I mean, so you take control. If a doctor all of a sudden, and to be honest, we've had patients that I went into the exam room, and I'm starting to talk about a patient that had lung cancer, and it's a different patient, because they put the wrong chart on the wrong door. Well, I see 150 patients a week. I'm not going to remember everybody's face. So don't be passive. If you think they're saying something that doesn't fit, stop them and ask them to explain and get to the bottom of it. So don't be passive about this. All right. So basically, what we're talking about is all of this surrounds around you. The whole world, no matter what your husband says, the world does revolve around you. So we can make a difference by taking control of our own health care. And I think that might be the last slide. Oh, there's a couple of questions here. So true or false? It is estimated that chronic illnesses presently account for 60% of all health care in America. True or false?
False.
It is kind of both, because it actually is 75 to 80%. And that's something we talked about, because I said 80% of all the healthcare costs are in the last 5 years of your life. Well, trust me, if you have a chronic illness for 50 years and you don't know about it, the shit's going to hit the fan in the last 5 years of your life. And we always hear, you know, oh, my golden years. If I had known my golden years were going to be like this isn't my golden years. Well, if you'd have done a better job at 30, 40, and 50 years old, 75 wouldn't be so bad. So that's where we're all trying to get. Here's an interesting one. I don't know how up to date you guys are on this stuff. What do you think the average hospital stay is? No, for just somebody goes into the hospital and they take all hospital stays and average them out. How much do you think each hospital stay costs?
70,000.
70,000? Well,
300,000.
no, it's actually only about $14,000.
How many?
14,000, but that counts hernia repairs that are there overnight and all kinds of stuff. The average physician cost visit, what do you think?
150.
That's very close. It's $120. The average emergency room cost,
5,000.
it's in between those two. It's about $1,000. Yeah, but see, a lot of those are just a sore throat. You know, somebody goes in, you do a swab to make sure, you know, that they don't have something bad, and you give them an antibiotic and send them out the door. And that's another thing. Sore throats, over 90% of all sore throats are not bacterial. So an antibiotic is not going to help fix a sore throat. Just letting you know, 90% of them are viral. So average prescription cost, that's very close. Oh, here it comes. So $14,200 for average hospital stay. Now, my initial hospital stay was $1.1 million. And I've had several of them over $50,000 since then. So the average physician visit is about 120 bucks. Average emergency room is around $1,000, and average prescription is 111. How much do you think the current healthcare plan costs? Now, you guys know what you pay, but how much do you think an average healthcare plan costs per year?
Family?
Well, they're going to give a breakdown. Family is fine, or single. What do you think?
7,000.
That's close for an individual
For a year.
for a year.
Family?
It's about $25,000. So a family plan costs, in an HMO costs $24,000 a year. An individual is $7,500. So healthcare costs, we really need to rein in. And we can only do it as a society. We can't, everybody has to do their own part. So I think that's, as Forrest Gump would say, that's all I have to say about that. I think that's it.
Yeah. Thank you.
You're welcome. Did I go over?
No, you're in good shape. It's really very interesting. Great job. Does anyone have
Any questions?
Questions? Yeah.
Yeah, any questions at all?
Well, thank you for your attention. Now, I know a lot of you, and thanks again, Glenn.
Thank
You want to go get a drink of water?
Yes. A lot of you picked this handout up. I know everyone doesn't have it though, so I'll walk around in just a minute and make sure, stand in the middle so you can come up and get one comment. This is just what we call a teaser, I guess you could say, in marketing terms, of the next session. Wacora is going to introduce their online health management platform, they call it, so that people can get onto their platform. And you know, now it's kind of hard for you to keep track of your points and know exactly what components you still have to do, like you know, did I do, how many educational sessions have I gone to, how many wellness activities have I done, and just anything about the wellness program. You'll be able to set up a user ID and a password, go into the Wacora health management platform, and you'll have a confidential password that only you know, by the way, and you can look at your data, and you won't be, you know, dependent on the nurses at Wacora to give you that information. And you can also, and this is just optional, but you can set up your own wellness goals and things like that aren't even part of our program. But if you just want to, on your own, even do more than what we're plugged into through our insurance, go for it. It'd be a great thing if you have the inclination and you like to work, on computer websites and whatnot. If you're sitting there and you think, ooh, I don't have a computer, or I'm not real computer savvy, or maybe some of you feel, yeah, with a little bit of help I could do it, or whatever, there will be help. There's going to be help to try to get everyone involved in this, and we're looking at setting up kiosks or computers like in transportation. I don't know. To be honest, I don't even know right now what kind of computer access the transportation department employees really have, but I don't think it's very good, right? So that's a deficit that we know that we have to address, and we will work on that part of it. But anyway, this is just, that's going to be on March 25th at the same times as today's session, 1:15 and 3:15. Who all needs 1:15?